Israel suspicious of any Iran nuclear deal? Experts say there is a deal with Iran that Israel can live with, but Israel will still criticize any accord signed at the United Nations in the coming weeks over Iran's nuclear capacity. U.S. Secretary of State John Kerry on Wednesday sought to reassure skeptics in Israel worried that Iran, despite any deal, might still be left with the capacity to make a nuclear bomb. We will not allow this agreement, should it be reached, to buy time or to allow for the acceptance of an agreement that does not properly addresses our core, fundamental concerns, Kerry said in Washington. Earlier in the week, Israel's Haaretz newspaper cited U.S. sources as saying the proposed deal with Iran would include a halt to the construction of Iran's heavy water plant Arak, a freeze on Iran's existing stockpile of enriched uranium, and tough inspections. In addition to limiting all uranium enrichment to 19.75%, Iran would undertake to freeze current levels of its stockpiles of enriched uranium as a whole, according to the report. This would mean that Tehran would have to hand over previously enriched uranium equal to the quantities of newly enriched uranium produced in Iranian reactors, Haaretz reported. It is believed the heavy water plant in West Iran, Arak or IR-40, once built, would be capable of producing enough plutonium for up to 2 nuclear bombs a year. Nuclear ambitions. Israel is demanding that Iran stop all nuclear enrichment and destroy its centrifuge, but many Israelis think that Iran will pursue its ultimate goal no matter what. I think if Iran wants a nuclear weapon, it will get one, and this deal will not stop them, said Elizabeth Zuvkov, a master's student at Tel Aviv University. This deal is only for 6 months. I don't think we will see any final. Negotiations have been ongoing since 2003, and the deal offered this time appears worse than those offered in 2003 and 2005. I think Netanyahu has handled it very badly. This deal is a real blow for him. It's created real tensions. When you see Israeli officials from embassies going to Congress to convince them to strengthen sanctions, it is a violation of how states should behave, said Zuvkov. Amir Mizroch, editor-in-chief of the newsletter Israel Hayom, said Iran would never truly give up its nuclear weapons ambitions. Israelis in general are monochromatic on the Iranian issue, for better or for worse, believing it presents an existential threat, that we will ultimately be left alone to deal with it, and that the world has no stomach for a fight with Iran, says Ms. Roach. Netanyahu's calculated risk. Jonathan Reinhold, senior lecturer in political studies at Bar Ilan University, said Prime Minister Benjamin Netanyahu was taking a calculated risk by being so outspoken over the deal. In the meantime, Israel will suffer for a while. But Netanyahu knows this and thinks it worth it if it stops a bad deal. Reinhold said the type of deal Netanyahu could live with would include suspension of the construction of the Arak reactor, limiting uranium refinement to 20%, handing over all uranium currently refined at 20% or more to outside powers, or converting it to a less refined state, not allowing any new fast centrifuge to be used, and genuine intrusive international inspections to ensure implementation. He said Israel would want sanctions to be automatically reimposed if Iran was found to be cheating, and new sanctions imposed after 6 months if the Iranians refused to give up their nuclear program. Even then, the PM opposes the P5, Britain, France, US, Russia, China, allowing Iran to enrich to 3.5% since they have no right to do so, and because he fears that despite safeguards, this would allow Iran to be a nuclear threshold state. Reinhold told DW. Military strike? Reinhold said any deal would make an Israeli strike difficult, unless the Iranians were caught cheating, but he didn't rule it out. Given Obama's hesitance in confronting Syria after they crossed the red line, Israel might act independently regardless of the U.S. position. In the event of cheating, more Iranians believe that to be the case, the less likely they are to cheat. In the past, they have altered the pace and nature of their program in response to Israeli positions. Mir Litvak, director of the Center of Iranian Studies at Tel Aviv University, said he believed there would be a deal in the next 2 weeks and that Iran would agree to increase International Energy Agency's supervision and to stop enriching uranium beyond 20%. According to Litvak, Israel would not attack Iran without U.S. consent, and that Netanyahu was big on rhetoric but nevertheless cautious and prudent. They say Teddy Roosevelt spoke carefully and carried a big stick. Netanyahu is the opposite. There is a big gap between his action and his rhetoric, said Litvak. Litvak is convinced that Iran will agree to dispose of its first-generation centrifuge, most of which are dated and broken, but will want to hang on to the new generation. It all looks wonderful if Iran keeps its part of the bargain, but if they violate it, they will still have enough uranium for maybe 1 bomb, said Litvak. No one will listen to Israel, and ironically, all that Netanyahu is doing is helping Iran's President Hassan Rouhani sells the deal inside Iran, as he can say, "Look, the Zionists are complaining. It must be good." Hero or traitor? Only history will decide. Howard Schmidt, former White House cybersecurity advisor, tells DW the U.S. has gone too far in its surveillance operations, but he believes only time will tell whether whistleblower Edward Snowden is a hero or a traitor. Howard A. Schmidt most recently served as U.S. President Barack Obama's cybersecurity coordinator from 2009 to 2012. After the 9/11 terrorist attacks, Schmidt also served as a cybersecurity advisor to former President George Washington Bush. D.W. In terms of the NSA debate, a lot of what we now know has come through Edward Snowden's leaks. Before him, there was WikiLeaks. Julian Assange is housebound in the London embassy. And now their aide, Sarah Harrison, fears going back to the UK over legal consequences. Are these individuals whistleblowers? Schmidt. I think there are a couple of aspects to that. One, there's a legal component. I'm not a lawyer, but when you look at someone committing a crime based on whatever basis, you have to face those consequences. And I think these people have all decided that. The second piece of that is the future will determine whether or not it falls under the category of whistleblower and hero or criminal and traitor. I don't think any of us can decide this at this time. We're too close to it. So in the future, when we look back at the Pentagon Papers and those sorts of things, our perspective is far different today than it was then. So, making judgments now of right, wrong, or indifferent, only history will decide that. Journalists working on the Snowden files claim that the NSA surveillance activities are much broader than what's described in the current reporting. I don't know, and I can only speculate. One of the questions I get asked all the time is how much about this did I know? The thing is when you talk about classified government programs is they're very compartmentalized. The category we always use is you don't have a need to know. My job was defenses. As a matter of fact, my work was based on stopping people from doing things like this surveillance. So as a consequence, they're not going to be telling me that they're doing something that I'm trying to fight against. So to that extent, it is possible. Is it possible? The revelation that Chancellor Merkel was being eavesdropped on by the NSA has been very controversial in Germany. Has the US gone too far in its global surveillance activities? It's my personal opinion that we have. Not only us, but others have done the same thing. Not necessarily for Angela Merkel, but they're done it for other leaders because there is perspective that somehow you get an edge on someone else if you do those sorts of things. Even though morally they may be wrong, in many cases it's legal for them to do it. The rules are different against citizens of one nation relative to another nation. So what we have to do is we have to collectively around the world back away from that. Focus on things that are important. Yes, guess what? You're going to go into a meeting and you are not going to know what the other side thinks. But we've done that for light years, and that's what we have to go forward with. We have to start understanding you may not know everything, but that's why we have negotiations. That's why we have teams to help to put things together and not somehow. If I know everything about you, I can conquer you. That's not the world we live in. Berlin has called on the U.S. to sign a bilateral no-spy agreement in responses to revelations about NSA surveillance in Germany. There are reports that while the Obama administration is willing to increase intelligence cooperation with Berlin, it is unwilling to sign a broader no-spy agreement. What could explain White House reluctance? I don't know why they're saying that now, but I know one of the things that's been discussed, not necessarily with Germany, but I've heard different nations say this. Well, why would I sign something to give up a capability I already have that puts me in a better position? That is my only speculation as to why someone would be hesitant to do something like that, especially with friends. So there should be a mechanism set up where somebody can pick up the phone and contact somebody in BKA or BSI, German Federal Police and Federal Office for Information Security, respectively, or somebody and say, we see this really dangerous activity coming from a server in your nation. We need your cooperation to shut it down or to monitor or do whatever we do. We don't do that enough. And that's the first step we have to do moving forward, is to set that process in place so we have better trust. Telecommunications infrastructure is global in many ways. Brazil and Germany have submitted a draft resolution at the UN that seeks to strengthen international norms for the protection of privacy. Do you believe the US supports the initiative? I don't know if regulation is the key as opposed to agreement, and there is a distinction. For example, in the United States, we've been trying for years to get privacy protection laws changed. We did a green paper and a white paper when I was at the White House. To this day, we still don't have that passed in the United States. So trying to do that globally is going to be a tremendous task, but we should start moving down that path. We can't wait 5 years to start the dialogue. We need to be doing it now. It has to be done now. It has to be concentrated. It has to be consistent. Are privacy protections too weak then? I think they are. Anytime you have privacy protections based on constructive or based on constitutions or based on democracy, they have to be put in stone and stay there. There always should be exceptions and legitimate exceptions, but that's under a unique set of circumstances, and that set of circumstances has to be accounted for in a lot of the cybersecurity things that we do, because you can't give up the protection of your citizens. I mean, that's one of the key rules of government, but you can't overreach in doing it. The legal interpretation of intelligence operations and many of the court rulings are secret. How is reform possible if the public doesn't know the full extent of what's happening? Well, I think right now the public knows enough to say, I demand some answers now. I demand a change of the way the business is done. But I think a lot of this once again is going to come from the private sector. The private sector that says, I may not know everything. I know what I know now, and I can envision what I don't know. So therefore, as my government, my expectation is for you to fix this. Whether we in the private sector making recommendations, we become some sort of a structure that better gives the government what our needs are and what it means to work in a global community as we see the internet today. It's going to take some of that, but it has to be demanded by the companies and the people, irrespective of what they know. That would then in turn change the policies. Once the policy changed, the court would then look at the interpretation of these things, and I think we'll all be better for it. Big data in healthcare. How comfortable are you in your role as research patient? The UK's National Health Service is turning to IT in a big way, with plans to be completely paperless by 2018. More significantly, it wants to make much of that massive data supply transparent. The UK's National Health Service has been set a goal: increase efficiency and improve patient care by going paperless by 2018. But before that, the NHS is due to make public huge volumes of digital data derived from the patients from whom it has provided care. In fact, that's happening right now. Back in December of 2011, Prime Minister David Cameron labeled every NHS patient a research patient because, he said, the service was opening up vast amounts of so-called big data to those who would use it to improve healthcare in the US and worldwide. This is the real-world evidence that scientists have been crying out for, said Carmen. But while the move has been widely praised, it also has its critics. On the front lines, general practitioner Dr. Hardian Moss is both cheerleader for the using of big data and critic of the way in which the UK government has decided to seek permissions from patients and anonymize data. It doesn't really seek permission. It assumes permission unless a patient says otherwise. Dr. Moss liked the idea of gathering all the digital information the NHS has at its disposal and sharing it internally with other doctors, clinicians, and hospitals, as well as externally with researchers, pharmaceutical interest, and health-related business. Moss is one of 6 doctors at the NHS practice servicing about 12,500 people. Really, as soon as the patient walks in the door, I'll have already looked at their medical record, previous consultations, results, and any investigations, said Moss. Everything is initially available on the computer screen. But networking between hospital IT systems in the NHS and those of external doctors, or even from one hospital to another, can be seriously lacking, sometimes with fatal consequences. Jeremy Hunt, the government's health security in charge of the NHS, has admitted that 11 hospital patients died last year because they were given the wrong medication. He says digitizing the system, going paperless, won't solve all of the woes related to information flow, but it will help. What will help even more, says Tim Kelsey, NHS England's first ever director for patients and information, is to open up all that data to the outside world. Open data is the most impatient things we're going to be doing in our generation in terms of improving healthcare, says Kelsey. I fundamentally believe transparency is going to transform both quality and the experience that patients have of their care and the cost of the NHS. Big data has already offered dividends to the NHS, according to a report by Chris Yu, the outgoing head of digital government at the British think tank Policy Exchange. The NHS is unique in the world in terms of the breadth of population that it covers and how long it's been up and running, Yoon says. It is one of the richest continuous linked set of data on citizens anywhere in the world. Looking into that data with modern computing power to understand some of the patterns that are in there could be hugely beneficial in terms of medical science. Yu and one of his Twitter followers, the NHS Tim Kelsey, as well as the British Prime Minister David Cameron, all says it's a matter of urgency to make big data on patients and their medical history transparent, while keeping the patients anonymous. But is big data happening like that? Privacy and permission. The notion that these records are anonymous because they don't have a name and address is simply false. Words Martin Thomas of the Institution of Energy and Technology's Information Technology Policy Panel. Last month, Thomas wrote an opinion piece for the Health Service Journal describing big data as unthinking, ignorant, and callous. The data that is being extracted from doctors' records won't include the patient's name and address, but it will include their passport, their age, their date of birth, their gender, their ethnicity, says Thomas. In many cases, that alone is enough to re-identify the individual. Perhaps more difficult for Thomas and other privacy advocates to swallow was the change made to the NHS constitution. The default setting now gives permission to use the patient's data, unless they specifically choose to opt out. No opt-out means you and your medical data are in. Dr. Hardian Moss, the GP from Northamptonshire, says that's wrong. He says, 2 million leaflets dropped across the UK, explaining that NHS patients have to proactively opt out of big data if they're uncomfortable with the new NHS rules. Most people don't read their junk mail. They throw it away, said Mose, and the government is going to interpret that as implied consent to the sharing of data, whereas in fact in all households of 6 people, there may be only one person who read the letter. But because of this implied consent, all their data will be shared. Both Mose and Thomas admit there are positives to be gained from the sharing of big data, such as the ability to study the health records of the complete population, or the potential for studying the efficiency and to the efficacy and efficiency or medication. But they're also very clear about its potential harm to people, whose conditions, they say, should be kept private for reasons of possible discrimination, private insurance costs, even personal safety in the case of an abusive family member. A balance needs to be found for the sake of such people, says Martha Thomas, who warns data is forever.